What if the food on your plate mattered just as much as the medication in your cabinet? High blood pressure is one of the biggest killers worldwide, yet millions of people focus only on pills, while ignoring the lifestyle choices that quietly fuel the problem every single day. Today, we're breaking down powerful evidence showing how the Mediterranean diet isn't just healthy eating, but may be a key player in blood pressure control, kidney health, cholesterol balance, and overall cardiovascular risk. The results may surprise you. Why hypertension matters. Hypertension, or high blood pressure, is one of the strongest risk factors for heart disease, stroke, kidney failure, and early death. In our study, people with hypertension didn't just have higher blood pressure. They had more health problems overall. Compared to people with normal blood pressure, hypertensive patients showed worse kidney function, higher uric acid levels, higher total and LDL cholesterol, higher triglycerides, lower HDL cholesterol, higher body weight and BMI. In short, hypertension rarely comes alone. It travels with a cluster of metabolic and cardiovascular problems. Cardiovascular risk. This unhealthy combination creates a much worse cardiovascular risk profile. People with hypertension were more likely to show the following signs: dyslipidemia, obesity, metabolic imbalance. Interestingly, some control subjects had higher rates of peripheral artery disease and heart rhythm disorders. A likely explanation is smoking, which is an independent risk factor for both conditions. This reminds us that diet, blood pressure, and lifestyle factors like smoking are deeply interconnected. Mediterranean diet and kidney health. One of the clearest findings involved kidney function. Among people with hypertension, we found the following results. Those who followed the Mediterranean diet less closely had much higher rates of chronic kidney disease. Those with better adherence showed significantly better kidney health. This supports the idea that diet quality plays a major role in protecting the kidneys, especially in people already at risk due to high blood pressure. Cholesterol and lipids. A big difference. The Mediterranean diet also made a major difference in cholesterol levels. The following results were noticed in hypertensive patients who closely followed this diet. Lower total cholesterol, lower LDL, bad cholesterol, lower triglycerides, higher HDL, good cholesterol. Meanwhile, poor adherence was linked to widespread dyslipidemia and a much worse lipid profile. This reinforces what many studies have shown. The Mediterranean diet consistently improves lipid metabolism, especially compared to Western-style diets. The uric acid puzzle. One unexpected finding was higher uric acid levels in some hypertensive patients who followed the Mediterranean diet more closely. This may sound contradictory, but context matters. These individuals also had higher body weight, higher rates of diabetes, worse overall metabolic health in people with underlying metabolic problems. Factors like moderate alcohol intake or liver dysfunction may influence uric acid levels, regardless of diet quality. So this doesn't discredit the Mediterranean diet, but rather highlights how diet interacts with existing health conditions. What are the benefits of following the Mediterranean diet more? A significant result was observed. People without hypertension showed higher overall adherence to the Mediterranean diet compared to those with high blood pressure. This raises an important question: could better adherence help prevent hypertension in the first place? While science hasn't fully settled this yet, our findings strongly suggest that diet quality may influence whether high blood pressure develops over time. Low adherence equals higher risk. When we looked at adherence more closely, a clear pattern emerged. Lower adherence to the Mediterranean diet was associated with higher BMI, worse cholesterol profiles, higher rates of diabetes, more peripheral artery disease, more chronic kidney disease together. This reflects a classic picture of metabolic syndrome, accelerated atherosclerosis, and increased cardiovascular risk. In contrast, higher adherence was linked to a healthier metabolic profile and lower overall risk. Why the Mediterranean diet works? So why does this diet matter so much? The Mediterranean diet emphasizes olive oil as the main fat source, fruits, vegetables, nuts, and legumes. Healthy unsaturated fats. Olive oil is rich in polyphenols, which support blood vessel function, reduce inflammation, and improve nitric oxide production, helping blood vessels relax and function properly. These effects can support better blood pressure regulation and vascular health over time. Mediterranean diet versus DASH, dietary approaches to stop hypertension. When compared to the DASH diet, the only diet universally recognized for lowering blood pressure, the Mediterranean diet shares many similarities. Both prioritize plant-based foods, healthy fats, reduced red meat intake. The DASH diet places more emphasis on salt reduction, while the Mediterranean diet focuses more on healthy fats and lifestyle balance. Despite their differences, both diets support heart health and blood pressure control. So what's the real takeaway? This study shows that people with hypertension tend to have worse metabolic health who follow the Mediterranean diet less closely. Among hypertensive patients, poor adherence to this diet is strongly linked to worse cholesterol levels, kidney disease, vascular damage, and higher cardiovascular risk. The Mediterranean diet isn't just about food. It's a lifestyle rooted in balance, tradition, and long-term health. While it's not a replacement for medical treatment, it may be one of the most powerful tools we have for preventing and managing high blood pressure naturally. If this video helped you understand how diet impacts blood pressure and heart health, hit like, subscribe, and share it with someone who needs to hear this. Your next meal might matter more than you think.